Yeah. All right, welcome to Deuk Spine Institute. It is February 4, 2025. I'm Dr. Deuk Majan. Our patient travels here from Wisconsin. He has had horrible back pain for years, but his last episode has been 4 years. He's had a fusion done already at L4-5. He now has pain coming from different areas, but specifically, he has pain from the disc above the fusion, below the fusion, and the piriformis and the sacroiliac joint. So we're going to fix all of those today. We're going to do 3 streams. The first stream will be fixing the discs. All right, can I give him some local? We're going to get started. If you have questions, type them up, and Henry will ask me the questions. I'll do my best to answer them.
Of course.
We're going to give you a little numbing medicine, okay? Just lay still. You're doing great. That's just a little numbing medicine. Don't worry. Lay still. You're doing awesome. All right, Henry. Since we've talked about this patient having 4 different areas causing his pain, why don't we show our video on the 30 causes of back pain?
Of course.
I'm Dr. R. Deuk Majan with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine touches the vertebral bodies with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. All right, welcome back. We're just getting our patient ready. What do you know? Now, if you look at his x-ray, we're looking around because we're going to be doing a piriformis release. You guys see the artificial hip?
Yes, we do.
Shot? All right, now the piriformis muscle runs literally right here, right where I had that circle. Let's go back up. So we're going to numb that skin up in anticipation of doing his piriformis release in a little bit. We're starting with his Deuk laser disc repair. Now you've had a chance to see the 30 most common causes of chronic back pain. Means back pain that's been around for a long time. How are we doing, Dr. B? No, we're trying to do our discogram.
How you doing, my friend? You okay? Open your eyes for me.
Are you awake?
How you doing?
Yeah, the marker. So far, we've placed 2 spinal needles from the right side of his spine, above and below his fusion, into the discs at L5-S1 and L3-4. L3-4, okay? The L4-5 is fused. He had that done before he heard about me. So we forgive him. Okay? We're here to fix the 2 discs that are causing pain above and below.
Open your eyes for me.
How close is he? How close?
How you doing? Can you open your eyes for me?
You having any pain?
You having any back pain, my friend?
You having any pain? All right, so I want to do a quick discogram. Let's just check 5-1 real quick, see where it is. Shot? All right, good. So we're in the disc. That's good. You guys see the screws and rods?
Yes, we do.
So this is a fusion with instrumentation. Earlier today we did a fusion without screws and rods. We just did an onlay fusion. But that's what they look like. Screws, those are really long screws in his bone. It restricts the movement of your spine. It takes away your movement in your lower back permanently for the rest of your life. You don't want that. We are repairing his disc naturally. He found out about us after his fusion. So had he found out about the Deuk laser disc repair before the fusion, he never would have had the fusion done. But he's fused at L4-5. How much time?
I think he's ready to go.
You awake?
You ready to go, my friend? We're going to ask you a question. Open your eyes. Open. You having any back pain?
If we need to go piriformis, we can go piriformis first. Yes? All right, let's do his piriformis. We did.
Oh, okay.
All right, folks, we're going to jump over to his piriformis while he wakes up. Remember, you saw the artificial hip. When they do an artificial hip, they still leave the piriformis muscle attached. He has a tear in that muscle. Henry, why don't you show the audience what a piriformis syndrome is and how we fix it?
Of course.
Shot?
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear. in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes, minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Come on back. You guys see now what we did. We did a piriformis muscle release, 4mm incision. We just finished. And it wasn't easy because he's had a hip replacement. So they did a metal hip right in that same area that we're working. And but it went well. I could feel a lot of scar tissue in there from this prior surgery, but I could also feel that the piriformis muscle was there and we released it. So we got that out of the way. Are you awake?
How are you doing, my friend? You all right?
Now, the most painful surgery we do here is this fusion, obviously, but then afterwards is the piriformis release. People have discomfort in the buttock after the procedure. It's normal. And now we're going to move on to his disc surgery. All right, do you think he's awake?
Open up your eyes for me. You having any back pain? No back pain?
All right, let's just go ahead and shot. There's a tear in the back of the disc at 3-4. Show us, Jordan. Yep. All right, let's go ahead and get the 5-1 done as well. I don't think he's responsive enough to answer any questions, unfortunately. So we'll just keep him asleep and we'll get his surgery done. Let's start with 3-4. If you have questions, feel free to ask me.
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain?
I think that's a great idea, Henry. Thank you.
Of course.
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. Henry, did you show them how herniated discs cause back pain through the tear in the back of the disc?
Yes, I did.
And how about how we fix that back pain with the laser?
I could show them right now.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We are entering the disc at L3-4. We're going straight through the tear and herniation. And we're in the tear right now, at the base of the tear. We're going to start cleaning the tear with the laser. The laser will clean the tear and get rid of all the pain coming from that tear. That's what the laser does. And it does it every single time. I have done this surgery 2,500 times, and it has never not worked at getting rid of the discogenic back pain. That's the back pain that comes from the disc. I've never had a single failure. Now, we have people who have other kinds of pain from other areas, but Luis, what is that? See it on the left? Yeah, uh-huh. Huh? What do you think that is? Nikki, you're making me laugh. We had to have put it there. So, no, hold on. Sorry, guys and gals, I have to check something here. Doesn't appear to be the camera. Must be the scope. It's the scope, probably, right? I think we're okay, though. It's not really in my field of view. It's just at the base, but I would check it out. All right, any questions for me as I proceed to use the laser to debride this tear at L3-4?
Yes, we have a question coming from Remick, R-E-M-I-C-K, on YouTube.
Hi, Renick. Welcome to our stream of spine surgery from Deuk Spine Institute in Florida.
Asking, is less disc removed if there is just an annular tear and not a disc herniation?
Yeah, Renick, great question. First of all, we're not removing any disc at all. All we're taking out is the herniation. This procedure is not a discectomy. This procedure is really an annular debridement. It's cleaning out the herniation stuck in the annular tear. Like this stuff right here that I'm grabbing and pulling out. That grungy material right there, that's not normal. I would have another scope on standby.
Please, thank you.
That material right there is herniated disc, and it's stuck down from scar tissue. I need to clean it out with the laser. It just won't come out with the grabber. See that? All that is abnormal tissue. And it's been there for a while. This is not a new problem. It's very calcified. It's like a little rock right here I got to work on. I'm going to come back to that in a moment. Grabber. I got a piece of it, but it's fragmenting in little pieces. Any other questions? Oh, there's a nice piece.
At this moment, no current questions.
All right. We've shown the 30 causes of chronic back pain. We've shown the disc as a cause and how it's treated with the laser.
Correct.
By the way, for those of you who joined us for the fusion this morning, that patient went home literally 2 hours after his surgery with no pain at all in his back. He was very happy. Okay, you can see once again the blue stuff is the nucleus that's degenerated. It's abnormal nuclear material. This stuff here is scar tissue with calcification. That's why it's white. It's collagen basically. And right here is the active tear. You can see that earlier, if you rewind a little, there was some pink material. That's the inflammatory material. There it is. There's more of it right there. That's where all the pain comes from. That's the inflammation we have on the video. Let's show that video one more time now that people can actually see it with their own eyes.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Let me do one more grab. All right, welcome back. You can see from the video once again that there's inflammation, which is the pink reddish stuff on the video. That's at the tear right there. And the inflammation is fed by blood vessels right here in the outer annulus fibrosis of the disc, where the annulus meets what's called the posterior longitudinal ligament. And this area where the annulus blends in with the PLL has a lot of blood vessels and nerves, and that's why these tears that are in the back of the disc are so painful, because the innervation to the back of the disc is not like the innervation to the sides or front. It's different. The innervation to the back of the disc goes straight up to your primary somatosensory cortex, where sensory inputs are organized in what's called a somatotopic pattern, basically where your brain will know exactly where the stimulus comes from, and we call that localized. So the pain stimulus going to your primary somatosensory cortex is highly localized pain, okay? And same type of pain that comes from your finger or your skin or a joint, where you can tell exactly where the pain's coming from, because those nerve fibers travel to the same parts of your brain, the primary somatosensory cortex. On the other hand, pain fibers that are embedded in the sides and back of, front of your disc, sorry, not back, but front and sides, those pain fibers, they travel to a different part of your brain. They travel to subconscious parts of the brain, where you actually don't have conscious perception, where the pain is highly localized, like it does for the back of the disc. Okay? Why is it organized that way? Well, since I'm the one who discovered it, there really is no answer. Nobody really knows why it's organized that way. I think I know why, but I could give you a theory. But nobody's ever proven why it's organized this way. I believe the back of the disc is painful because, let's face it, when you have a herniation in the back of your disc, that can actually pinch your nerve going down your leg and cause weakness, okay? And if you're a Neanderthal or a human moving around in a world that requires you to be very physical, you need movement of your legs to survive, to capture food, to get away from animals hunting you like wolves and bears. So if you have a tear in the back of your disc and your sciatic nerve is about to be pressed on by a herniation, there's an evolutionary advantage to people who can feel that tear. They're aware of it, and they modulate their behavior so that they actually don't make it worse. All right, we're done. That's really nice. That's part of the facet joint there. I might zap some of that too. He has an arthritic facet joint right there, you can see. That's going to be pain fibers on his facet. So we're just outside the disc, and now we're dealing with a facet capsule that's extremely inflamed. And you could argue it's the back of the disc, so I'm still doing my DLDR, but there it is. Done. We're done with 3-4. We have L5-S1 to do next. Thank you, Jordan. Scope off. Let's change the scope out. We're going to put a little antibiotics. I'm going to clean this area up a little bit. Any questions?
Yes, we have a question coming from JSL5570 on YouTube.
Hi, JSL. Welcome to our live stream.
Asking, doesn't cutting the piriformis muscle cause any issues? Was it its function?
Yeah. So a lot of people ask that question. It's an obvious question to ask, and it's a good question to ask. The piriformis muscle is a muscle, but the good news, it has a function that is to rotate the hip or rotate your thigh outwards. So, for example, if you were to look at your foot and make your toes go outwards, rotating, that's called external rotation. That's what it does. And the good news is it's not the only muscle that does that. There's 4 other muscles that do it, and of the 4 other muscles plus the piriformis, it's the one that does it the least. So really all the piriformis does is get torn and injured and cause horrible pain. So that's why getting rid of that pain is better than having a muscle that does nothing, if that makes sense. In other words, you are going to be so limited functionally if you leave that painful muscle there and you don't treat it. You're going to be in so much pain and so limited functionally, you're bedridden. It's better to treat it and lose that little bit of external rotation of your hip than it is to live with the pain. Does that make sense? So the living with the pain is incapacitating, debilitating. Hold this. And you can't do anything. So which would you rather have? An intact piriformis that was hurting and you couldn't get out of bed and do anything? Or get rid of that pain and have a normal functioning life minus one perfect muscle? Now, when we relax the muscle, it's not gone. It's still there. It can still contract and it can still participate in movement, but it's not going to be as effective. But then again, having that tear, it really doesn't do anything anyway besides hurt. So I know you're thinking, oh, it's like losing your bicep, but it's not. Your bicep is an important muscle. It's the only one that does the action of pulling up your forearm. You would never want to lose a bicep function, but if you had 5 muscles doing the same thing the bicep does, and one of those muscles doesn't really do anything, it doesn't add much to the function, and all it did was hurt, then you want to get rid of it. All right, a lot of scar tissue here I'm encountering from his fusion. You guys see the screws and rods?
Yes, we do.
We're navigating just past them right now. So it's not easy. I feel tons of scar tissue right now. Trying to push through it, get around it, and get down to that disc at 5-1. Not easy. But I think we're going to be able to get this done. All right, shot. We need everyone's support right now. All right, looking good. I need to aim down. All right, we're advancing the guide wire. Pull the guide wire back a little bit. I need to pull the guide wire back just a little. Guide wire is getting trapped. Okay, we don't want to trap the guide wire. Shot. All right, we're in the disc. We can pull the guide wire completely out. We're going to stay in this disc, and we're going to fix this disc. You can see some of the dye leaked out through the front of the disc too. We're not concerned with tears in the front of the disc. They don't cause any pain. Only tears in the back of the disc cause pain. Any other questions? Shot?
At this moment, no current questions.
All right, we're in. Okay, we're almost done. We've already done his right piriformis release. We've done the DLDR at 3-4. We're doing 5-1 now. And we've got the, no, right SI. Should be a right SI.
We need to double check it. At least with the board.
Huh?
I need to check that at least with the board because the board says bilateral. I want to make sure.
Go to the consent form.
Yeah. No, check that please.
Who's putting these things up on the board?
I think Hector wrote it down on the paper, so the nurse wrote it on the board, wrote down.
All right, this is a quality control issue we need to address. Can you address that, please? How is the board different than the consent? That shouldn't be. In
Consent never lies.
in 10 years of doing this, I've never had this discrepancy, but we've had it now twice in the last week. So, guys, what's going on with my irrigation?
That wasn't. When I changed it.
Sorry, we're good. Okay, there we go. Here's the herniation at 5-1. We don't have the scope issue. Everything's looking good. Again, people ask me, Dr. Deuk, why do you need the laser? Why can't you just use the grabber? You could see right there, the grabber cannot grab this stuff out. It's too hard. It's literally tough, and you just can't grab it and pull it out. It's too thick, too strong. You need the laser. The laser is the only way to do this surgery. It's impossible to do it without the laser. You will not get the results. You will not get the job done. You could take a drill, you know, from Home Depot, and you know, a DeWalt drill, and drill this thing. You might come close to what the laser can do, but think about that, how dangerous that would be. So the lasers, look how safe it is. This is a 1 millimeter glass fiber. The glass fiber you're looking at there moving around, dancing, is 1 millimeter wide. You're seeing it with such precision. That's because of the endoscope. So we're combining laser with endoscope and transforaminal surgery on the tear, and that's what we're doing. And that laser can actually remove tissue with a precision of 0.05 0.05 millimeters. Okay, think about that. Grabber. That's a 20th of a millimeter. So take a millimeter, cut into 20 pieces, or 20 areas along the length, and that's the precision that I have with this tool. There's nothing else in medicine as precise. Not even radiosurgery is this precise. 1/20th of a millimeter. That's 20 micrometers for you mathematicians out there. All right, any questions?
At this moment, no current questions.
Great. So we've got this right here, 5-1, and then we're going to do the right SI joint, DPR, and I think we're just going to roll with it, Henry.
I don't mind. That's fine with me. Yeah, I can add the chapters to this one, and so
Yeah.
we could do that. Not a
I think
problem.
that's a great idea. You put a time point, right?
Yep, perfect. We could do that with the Piriformis, the DLDR, and the SI. That's perfect.
I think it's a great idea.
Awesome.
I'll tell you what.
What's that?
Let's show the Piriformis one more time, because it's such a new video.
Yeah, it is.
We
Yeah,
haven't shown it very much, and I want people to see it.
agreed.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see how piriformis muscle injuries can be so painful, and of course how we fix them here at Deuk Spine Institute. Piriformis syndrome, or piriformis muscle tear pain, which is the same thing, are responsible for back pain in a large number of patients. As a matter of fact, it's close to 20% of patients with chronic back pain have a tear in their piriformis muscle and they need it fixed. All right, we just fixed that a few minutes ago as part of this patient's treatment. We're now finishing up his L5-S1 disc herniation. Very hard to get to because of his fusion and the collapsing of the disc, foraminal narrowing, but we're getting it done. I'm almost done here. Any questions before we wrap this up and move on to his SI joint?
Yes, we have a question coming from JSL once more on YouTube.
Hello, JSI. Welcome.
Asking, I have a 3 millimeter to 5 millimeter bulges from L1 through L5 with narrowing at some levels and moderate to severe nerve impingement at L4 and L5 and radiculopathy. The main injury was in 2012. Might I be a candidate with this?
Oh yeah, for sure you're a candidate for this, 100%. But the thing is, we can give you a free consultation. We offer it to anybody with back pain or neck pain. It's done virtually, so you don't even have to come here. We do it, thank you. We do it through Zoom. But to get that Zoom call, you've got to fill out our form, which is just going to ask you, like, where's your pain? How long have you had it? Does it go down your legs? It's going to ask you some basic questions, and then you need to give us your MRI DICOM images. Once we get those, we'll schedule a Zoom call. Sam will do that for you, and then I can give you a diagnosis. What's wrong? What's causing your problem? Which it may not be everything you talked about. It may be something completely different. And then we can tell you exactly how to fix it. So that's what I would recommend you do. Henry, will you put the link for the free MRI review?
Already did.
There. Great. Thank you for doing.
Of course.
Any other questions?
At this moment, no current questions.
All right. We're pretty much done here at 5-1. I'm going to do one more grab, and then we're going to move on to the SI joint, because he has sacroiliac joint pain. Oh yeah. Got a few pieces of herniation right there. Any other questions?
At this moment, no. Question from JSL once more on YouTube asking, I've had 3 MRIs from 2012 to 2022. Is 2022 current enough?
Why not? Let's try it. I'll accept it. Sam will complain when you submit it. Just tell her that you and I spoke and that Dr. Deuk says that he would do it anyway. So she'll let you in. It's probably okay as long as your symptoms haven't changed so much, since your last MRI. But if your symptoms have changed dramatically, then we need a new one. But otherwise, that should be okay.
We have another question.
And obviously, I would love to have a more recent MRI, but For your MRI review, it's fine. Yes.
Coming from David on YouTube, asking, I wanted to ask about the difference between the endoscopic posterior way and the anterior way.
Yeah, so there's no anterior way in the back, in the lower back. You can't do it anteriorly. You'll poke through the intestines and cause the poop in the bowels to squeeze out into the belly. It would be a life-threatening problem. You never go anterior endoscopic. It's just, there is a way to do it, but you don't do that for treating a disc problem like this. You could do it for a fusion, maybe even an artificial disc, but not for a posterior tear repair. So we don't do the anterior approach for lower back. We do the posterior lateral approach for the lower back and for the thoracic spine. For the neck, we go anterior. We go through the front. Yeah, so for a cervical herniated disc, we go through the front. We just did that surgery right before this one. You can watch it. And thoracic is through the back like this, and lumbar is through the back. Never through the anterior approach. All right. I need that. Need the stapler. I'm going to put another staple here. The patient takes meloxicam, and we had him stop, but you can see that there's still an effect of meloxicam happening. Wipe. And so that effect is on the platelet function. So basically, people bleed a little bit. We had him stop 10 days ago, but he's clearly still has some anti-platelet function effect. Shot. So not much we can do about it since we're here in surgery already. Shot. All right, we're getting x-ray pictures to localize. That's a good spot right there. Right in the middle of that, you don't need to go too deep. Right in the middle of that is where I'm going to make my incision. And we're going to go down to the places where the pain nerves to the SI joint live. Now these nerves, there's 5 of them, and they basically innervate the SI joint. SI joint stands for sacroiliac joint. And these nerves bring pain signals from the SI joint up to your brain. And the kind of pain they bring signals is arthritis pain, basically arthritis. And who wants arthritis pain getting to their brain? Nobody, right? We don't. Shot? So the problem with arthritis pain and arthritis is that arthritis is not curable. Okay, period. It's just not. Shot? Arthritis cannot be cured. However, the pain of arthritis can be. And that's what we're trying to do here. So my first target is the first nerve to the SI joint. It's called the L5 dorsal ramus. Shot?
We have a couple questions.
I'll take them.
These next two are coming from Faisal on Facebook.
Hi, Faisal.
First question they asked, so your laser treatment, you can do a decompression surgery and to remove pain due to inflammation. Are these both separate conditions? Oh, yeah, to do a decompression surgery and to remove pain due to inflammation. Are these both separate conditions?
I need to be lateral. Yeah, Faisal, it's really important to understand that decompression means to get the pressure off of a nerve or the spinal cord. Where's the x-ray? When you're decompressing, you're getting the pressure off a nerve or the spinal cord. And pinched nerves never, ever, ever cause pain in the back or leg. They don't cause any pain. Okay? Pinched nerves cause weakness in the arm, weakness in the leg, numbness in the arm, numbness in the leg. They never cause pain. Go to our website. It's one of the most common misconceptions people have, Shot, about pain is that it comes from pinched nerves. Okay? So can the laser unpinch a nerve? Yes. We do it all the time. Shot? We unpinch nerves all the time. Lateral inferior.
Next question from Faisal once more.
Well, let me finish.
Oh, of course. I'm so sorry.
Yeah, so the pain that people experience in their neck or back doesn't come from pinched nerves. It comes from inflammation that's in the back wall of the disc. If you go to the website or you go to our YouTube channel, you can see that. We show those videos all the time. It's very important you understand the difference. Shot? Yeah. All right. Well, I think we did it. I think we're done here. I feel pretty good about it. I got all the 5 nerves as far as I can tell. I'll put a little medicine to reduce the inflammation that he's going to have.
Sit down, please. Thank you.
But we're done. Any other questions?
Yes, we have about 2 more questions. Next one from Faisal once more on Facebook asking, if you require surgery, is it better for you to have it when you're younger than keep waiting it out when you're older? I feel that the older you are, the more risk can occur due to complications.
You're correct. So it depends on what surgery you're having done. If you're young and you want to have a fusion, I wouldn't do it. If you're young and you want to get fixed properly, you come here to Deuk Spine Institute. Let us do the proper treatment. Because let's face it, once we fix it, then you can have a normal life. And if you push it off for 10 years, then that's 10 more years of suffering, 10 more years of being careful, 10 more years of not enjoying life to its fullest. So yes, I agree. Get it done when you're younger, not just because you're healthier, but also because you get more return on your investment. Okay, you get to use it more. You get to use your back more, or your neck more, and you get more out of it. You get more out of life. So I think that's the main reason.
And then lastly, from David once more on YouTube, asking on this follow-up question from earlier, asking the difference between endoscopic posterior and the anterior. He meant for the neck part, posterior way, with drilling through the bone, does the bone recover and grow back? Been offered this kind of surgery in Poland by a very known surgeon who's done more than 1,000 surgeries. Then I met the laser surgery, and I don't know which one to do.
Well, first of all, it's a no-brainer. You come to Deuk Spine. The posterior approach is called a foraminotomy. It's a horrible surgery. You do not want that surgery. If you're having any pain in your neck, that surgery will not fix your neck pain, period. Okay, foraminotomy is the procedure you do when you cannot do the anterior approach. When you're not trained to do the anterior approach, when you don't have the equipment to do the anterior approach, when you don't have the experience and knowledge to do the anterior approach. If you take a surgeon who can go anterior or posterior in the neck, a good surgeon is going to go anterior because the disc herniation is anterior to the nerve and the root, the spinal cord. And that's what good surgeons do. Good surgeons can go anterior or posterior. They choose anterior. Surgeons who go posterior usually don't know how to do anterior. They're choosing posterior because that's all they know how to do. Posterior approach is the wrong way to go. It is a bad idea. I do posterior cervical foraminotomies all the time. I do them with open laminectomies. I used to do just foraminotomies. But once you remove the bone, you destroy the spine permanently. It is never going to grow back. The spine will never be the same.
And that is it for questions.
Have a nice evening. We'll see you next week.